Chronic traumatic encephalopathy, known as CTE, is a progressive degenerative disease which affects the brain of people who have suffered traumatic brain injuries and repeated concussions. It is most likely found in athletes who take part in contact sports such as football players and boxers. This disease persists over a period of years. CTE affects problems with thinking, memory loss, confusion, personality changes, depression, and behavioral changes, including aggression. An individual may mistake these symptoms as a common sign of aging, when in reality it is CTE. Chronic traumatic encephalopathy is believed to be related to the buildup of an abnormal form of protein known as tau. The buildup leads to the brain cell death, and CTE is most often caused because of the repeated hits to the head over a period of years. People who are diagnosed with this usually have gotten hit hundreds of times to the head. Subconcussive impacts are the biggest factor in the cause for CTE. A common misconception is that CTE is caused by concussions. However, that is false because it's caused by more than a few concussions. As of now, chronic traumatic encephalopathy can only be diagnosed after death when brain tissue is analyzed. Doctors who specialize in brain disease use chemicals to make the tau clumps visible after slicing the brain tissue open. The doctors then search for tau clumps that have a CTE pattern. The process can take up to several months to complete. The people who are at most risk for CTE are boxers and tackle football players because of the punches to the head and the hits to the helmets. Soccer players, ice hockey players, military veterans, and victims of domestic abuse are people who are at risk for CTE. Just because you are at risk for CTE, play one of those sports, or are a veteran or victim of abuse, it does not mean you will develop CTE. People who are more prone to chronic traumatic encephalopathy are those who have been playing sports at a younger age. Head impacts before the age of 12 have worse outcomes than after the age of 12. Athletes who have longer careers playing the contact sport are more likely to develop CTE than someone who, at the same age, had a shorter athletic career. Aaron Hernandez, the 27-year-old former Patriots player, committed suicide within his jail cell while serving life in prison for his murder charges. His brain, after his autopsy, was found with evidence of the most severe CTE ever found in a person his age. There was tremendous damage done that looked as though it took years to develop, says the Boston University CTE Center. There was extensive damage done to his frontal cortex, where his frontal lobe is responsible for making decisions, judgment, and cognition. This is possibly the cause and reasoning for his behaviors that had occurred, but they cannot be sure that the CTE is the reason for his crime. Some treatments for CTE are work with cognitive behavioral therapists to manage strategies to control mood changes. Massage, medications, acupuncture, and even craniosacral therapy are helpful for headaches that come with having CTE. Note-taking strategies and memory training exercises can be helpful in dealing with the memory loss and memory problems that come with having CTE. CTE is a disease that most people are unaware about. It is something that affects all of our cognitive functions and ultimately impairs the way we think, learn, behave, and act. This is a disease that affects many people's lives and is so prominent we educate people so they are aware of what is happening to individuals all over the world.